It's great to be part of the EUROSPA collaboration to contribute to sort of wider scientific endeavour and to allow bigger science that can be done than on just one country's data alone, looking at rarer events, different treatment patterns, and a wider number of patients.
It has actually been very important that the coordinating center in Copenhagen has been so effective, and we have achieved a lot, both regarding collaboration and research and publications. When we started all the work with registries about 20 years ago, that was because each individual registry could not obtain relevant data on rare prescriptions of drugs. So that's why it was important to have this collaboration so that you can have more data from many registries.
And it's a great opportunity for us to be a member of this great cooperation between registers, because this really gives us the power to investigate rare events and to compare differences between countries and registers, and really give a robust foundation for further epidemiologic research. And I think we have seen many great publications stemming from this initiative. So we are happy to be here, and Astra is proud to be a member of this nice community.
So why is it important for Sweden and ESAQIL to be involved in EUROSPA? I would say that one thing that I find very important with the studies that EUROSPA does that we check the similarities and the differences between the different European countries in terms of treatment recommendations, healthcare organization, and also prescription patterns. And this displays the inequities that are still there between the countries in Europe, which I think is very important. Of course, EUROSPA in itself will not be able to change that, but I still think it's important that we show the inequities for stakeholders, decision makers, and so on. So another thing I think is important, of course, is when we collaborate, we achieve a power which will be sufficient to also show more subtle differences that may still be clinically important. For example, before there were many studies looking at whether combining a TNFi with methotrexate in psoriatic arthritis, whether that made a difference in terms of efficacy, and it was very difficult to show if that was the case or not. But with the power within EUROSPA, it was possible to show that when you add methotrexate to TNFi, it actually increases the chance of achieving a more hard outcome, such as remission. And it was also possible to stratify for the different TNFis, showing that it was important in this respect for adalimumab and infliximab, but not for etanercept. Finally, I would also say that it's important that EUROSPA do a lot of methodological studies looking at, for example, how to best impute missing data in observational studies, which is also an important task because that's an important limitation in observational studies.
We have just joined EUROSPA in September 2023, so we are the new one, and we are really excited that we are now part of the research collaboration in Europe, and that we can participate with our data in the shared data analysis. And we are really looking forward that we can also now share our data for this European collaboration.
I think it's very important that we use our registry not only for routine care treatment of our patients with inflammatory arthritis, but also to get more knowledge on a group level that we can implement in the daily clinic. So I think it's a very enjoyable experience to meet all these skilled colleagues within the EUROSPA and then collaborate about rare outcomes or rare exposures within these diseases and look into how these powerful drugs, the biological drugs, etc., can be used for a purposeful meaning in our patient groups.
We find it very important to be part of the EUROSPA study perhaps for two reasons. To accumulate enough patients, which is key, of course, in register studies to get power. More is more, so to speak, and the other reason is, of course, to be able to compare results between countries, which is also quite important.
Being part of a research network collaboration allows us to evaluate safety and effectiveness in real life in patients mainly with spondyloarthritis. there is a lot of questions that we cannot answer just with randomized clinical trials. And combining high quality data from real life give us not only a statistical power, but also give us the possibility of compare clinical patterns and treatment safety in the long term in different countries in Europe. So we hope that with this data we can improve the management of our patients in real life.